Hello doctors, this is Dr. Hira Salman. Welcome to MCQ of the day from AMBOSS and let's just get started. So the question says a previously healthy 29-year-old man comes to the emergency department because of burning with urination for several days. He has also had pain in the right ankle for 3 days and pain and swelling in the left knee for 1 day. 2 weeks ago, he had several days of fever and bloody diarrhea, for which he was treated with antibiotics. Examination shows a small left knee effusion and bilateral conjunctival infection. Which of the following is the most likely additional finding in this patient? So he is a previously healthy 29-year-old man, landed up in the emergency department. What are the chief complaints? Burning with urination for several days. And he also had pain in the right ankle for 3 days and pain and swelling in the left knee for 1 day. And 2 weeks ago, he was having fever and bloody diarrhea. And for that, he was already treated with antibiotics. Now, when you did the examination, you saw a small left knee fusion and bilateral conjunctival infection. So what is the most likely additional finding you are going to see in this patient? This patient is having arthritis, conjunctivitis, and urethritis. So what comes in your mind with these three triad of urethritis, conjunctivitis, and arthritis? Yes, reactive arthritis. Okay, so one by one we are going to rule out. So we have decreased, either you're going to see decreased mobility of the chest wall, or you're going to see circular erythematous rash with central clearing, or pain on passive extension of the fingers, palpable mass in the right lower quadrant, tenderness at the insertion of the Achilles tendon, or non-tender subcutaneous nodules over the olecranon. So decrease. So one by one we are going to rule out this. So let's see all the explanations together. So first of all, what are the key points here? Burning with urination, pain in the right ankle, pain and swelling in the left knee, bilateral conjunctival infection. So this patient, urethritis, like he's having burning in urination, asymmetric oligoarticular arthritis, and conjunctivitis comprise the classic triad of reactive arthritis, the triad, a condition commonly triggered by diarrheal illness. Like in this patient, he was having bloody diarrhea 2 weeks ago. So why this decreased mobility of the chest wall we are not going to see in this patient? Because ankylosing spondylitis causes decreased mobility of the chest wall and spine, and patient can present with arthritis, eye inflammation, typically uveitis, and a history of bloody diarrhea from associated ulcerative colitis as seen here. But however, the characteristic manifestation of ankylosing spondylitis is neck and back pain, causing a stiffness that improves with activity, which is not seen in this patient. We don't have any such finding here. We don't have neck pain in this patient. We don't have back pain. Additionally, this condition does not cause urethritis. So there is no association of urethritis with ankylosing spondylitis. If it's a case of ankylosing spondylitis, yes, we may see bloody diarrhea here in this patient. We may see this eye inflammation, that is uveitis, but there is no urethritis. And of course, the typical presentation of ankylosing spondylitis in patients is neck and back pain, which is not the feature here in this patient. So this choice is excluded. Now, what about circular erythematous rash with central clearing? Whenever there's a word like this, central clearing and erythematous rash, what comes in your mind? Yes, Lyme disease. So erythema migrans, a circular erythematous rash with central clearing, is pathognomonic for early localized Lyme disease. And the second stage of Lyme disease also cause migratory arthralgia and conjunctivitis, like there you can see in this patient. However, the lack of a tick bite or environmental exposure in this patient history makes this diagnosis unlikely, because whenever we need to answer Lyme disease, there should be something in the history related to tick bite or insect bite, something like that. It's not the case here. Lyme disease is also inconsistent with this patient preceding diarrheal illness occurring urethritis. Of course, Lyme has no association with the diarrhea and it has no association with the urethritis. So this makes the choice unlikely. Now, what about pain on passive extension of the fingers? This passive extension, when we do the extension of the fingers and there is pain that typically presents the findings of tenosynovitis. So disseminated gonococcal infection that usually causes tenosynovitis, which result in pain on passive extension of the fingers. So whenever there is a word passive extension of the fingers, pain on passive extension of the fingers, always think about this tenosynovitis. So this disseminated gonococcal infection typically presents with migratory arthralgia. Yes, you can see arthralgia in those patients, and it's commonly preceded by urethritis. As seen here, in this case, we have urethritis, we have arthralgia. However, this infection does not cause conjunctivitis. This patient has striate and is not associated with preceding diarrheal illness. Like in this case, 2 weeks ago, he has a bloody diarrhea. That's not the case here. That it should not be in tenosynovitis. Additionally, a vesicular or pustular rash on the trunk and extremities would be expected. So if it's a case of tenosynovitis, you may find rashes like vesicular or pustular rashes on the trunk because of this disseminated gonococcal infection, but that is not the case here in this patient. So this is excluded. What about palpable mass in the right lower quadrant? Crohn's disease can cause terminal ileitis, which manifests as a palpable mass in the right lower quadrant. Although arthritis and eye inflammation, more commonly episcleritis and uveitis, are extra-intestinal manifestations of Crohn's disease, and this patient lacks this typical finding of what? Recurrent and non-bloody diarrhea. He's not having recurrent non-bloody diarrhea. He was just having a diarrhea which was bloody once. Additionally, Crohn's disease does not cause urethritis. You will not see urethritis in this case. In a case of Crohn's disease, although you can see infection, you can see arthritis, but you will not see urethritis in a case of Crohn's disease. So this is excluded. What about the tenderness at the insertion of the Achilles tendon? Why this is the right answer? Because enthesitis is what? It's an inflammation of the enthesis. That is the point where a tendon attaches to a bone. That site's inflammation causes tenderness at the insertion of the Achilles tendon. Another common manifestation of reactive arthritis. Other features of reactive arthritis include there may be sacroiliitis, there may be dactylitis, there may be oral lesions or keratoderma blendergicum. So these are the findings which you can see in a case of reactive arthritis. A part of this triad, a part of urethritis, conjunctivitis, and arthritis, you may find sacroiliitis, dactylitis, keratoderma blendergicum, and also this enthesitis. That is the tenderness at the insertion of the Achilles tendon. So yes, this is the additional finding you are going to see in this patient because this patient is a case of reactive arthritis. Okay, so this patient likely had an acute GI infection due to Shigella, Yersinia, Salmonella, Campylobacter. Patients with reactive arthritis following an enteric infection can develop aseptic urethritis, which is likely the case in this patient. So this patient likely had infection. Maybe there was a Campylobacter infection in this patient, maybe Salmonella, maybe Yersinia, Shigella, because these infections lead to reactive arthritis. And of course, this aseptic urethritis. And this is the case here. When you click here, it will take you to the library. Okay, what about non-tender subcutaneous nodules over the olecranon? So non-tender subcutaneous nodules over the olecranon are consistent with which factor? That's the rheumatoid nodules. And these nodules are present in rheumatoid arthritis condition. So rheumatoid arthritis can also cause joint pain. There may be eye inflammation there, but typically scleritis. However, the asymmetry of this patient's arthritis and involvement of large joints, like knee joint was involved in this patient, instead of small joints, make this diagnosis unlikely, like he is having unilateral knee pain. Now, additionally, this diagnosis is inconsistent with the patient's preceding diarrheal illness or current urethritis. So, of course, in this rheumatoid arthritis, you will not find any association with the diarrheal illness or any association with the urethritis. That is the case here. So, this is a typical case of reactive arthritis. So, what is the educational objective of this question? That whenever you see a patient who is having arthritis, who is having conjunctivitis, eye inflammation, who is having particularly what else? Arthritis, uveitis, this conjunctivitis and urethritis. So whenever you see these findings, that's a typical triad of reactive arthritis. And in this patient, you may find additional findings like, yes, like these findings. Tenderness, especially at the insertion of Achilles tendon, that is called enthesitis. You may find sacroiliitis, you may find dactylitis, you may find keratoderma blennorhachicum. So this is all about this. And we are having sessions on recall-based discussion. If anyone is interested, you're most welcome to join my virtual session lectures on WhatsApp. For that, you can just have a look on my Patreon page. Thank you so much and see you next session. Bye-bye.